Hello, and thank you for joining us. Our webinar will be beginning shortly. I want to take a moment to let you know some of our upcoming courses. Next Tuesday, June 9th at 12 p.m. Pacific will be Exposure Assessment for Epidemiology Research, Use of Routine Industrial Monitoring Data with Drs. Kathy Hammond and Betsy Knopf from UC Berkeley's Industrial Hygiene Program. Wednesday, June 17th at 12 p.m. Pacific, we will be partnering with the Center for Occupational Health and Safety Engineering at the University of Michigan for the webinar Considerations in Exoskeleton Human Factors presented by Dr. Leah Sterling. For more events, visit coeh.berkeley.edu/aboutCE. On behalf of the Center for Occupational and Environmental Health, I would like to welcome you to our webinar, Protecting California Workers from Wildfire Smoke, presented in partnership with the Labor Occupational Health Program at UC Berkeley. A few housekeeping items first. You will be muted during this presentation. If you would like to ask a question, please enter it into the Q&A box. We will save time at the end of the presentation to address as many questions as possible. A PDF of the slides along with webinar resources will be available on the webinar's website page. This presentation is being recorded and will be made available on the COEH YouTube page and on our website, coeh.berkeley.edu. All participants who logged in with their registration email will receive a link to the recording and an evaluation form that will qualify participants for a certificate of completion worth 1 continuing education contact hour. You will receive that email at about 12 p.m. tomorrow. At this time, I'm pleased to welcome our presenters. Suzanne Teran is Associate Director of the Labor Occupational Health Program at UC Berkeley and focuses much of her work on developing programs for immigrant workers, including addressing wildfire smoke hazards. Kevin Riley is the Director of Research and Evaluation at the UCLA Labor Occupational Safety and Health Program. He co-facilitates LOSH's School Action for Safety and Health Training courses for school personnel. Teresa Andrews is an Education and Outreach Specialist at the UC Davis Western Center for Agricultural Health and Safety and has extensive experience working with cultural minorities and has developed materials and conducted trainings for farm workers on wildfire smoke. Thank you for joining us. Suzanne is up first.
Thank you, Jessica. And yes, thank you all for joining us for today's webinar. I'm Suzanne Teran, and as Jessica just introduced, we're going to be 3 presenters today. We are from 3 university-based programs that have been involved in outreach and education and research around wildfire hazards with different worker populations. And we will each share a bit about our programs when we begin our section of the presentation. But before we begin, we want to invite all of you to participate in a poll so that we have a better sense of who is with us today. So you're going to see this poll come up, and if you could please select which industry you work in, represent, or work with, and you can select all that apply. And if you don't see it there, you can choose other and then add your industry in the chat box. So we'll give you a little bit of time to add on. Great. Good. All right, so again, welcome, and it's good to see there's a substantial number of occupational safety and health professionals, so it's good to share resources that you can then apply, and we see nursing, schools, good, because we'll be talking about that industry, as well as agriculture, and a sprinkling of others, which we will check into afterwards so that we can know who's with us. Thank you again for participating in that. So, okay, I'm gonna So fire season is upon us, and we thought it would be a good opportunity to do this overview of wildfire hazards and also about the standard that's in place in California to protect workers from wildfire smoke. So first, to review our objectives, and they are that after participating in this webinar, you will be able to identify the hazards and health effects of wildfire smoke and the types of protective measures that can be in place in the workplace to protect workers. You'll also be able to describe the requirements of the emergency Cal-OSHA standard on wildfire smoke and apply these requirements to two sectors, specifically looking at schools and agriculture. As I mentioned, we're each doing a section of the presentation, and I'm going to be speaking about wildfire smoke hazards and providing an overview of the standard. I'm with the Labor Occupational Health Program. We support workers and worker organizations in a variety of ways, from participatory worker training to developing materials in different formats, languages, and literacy level, as well as some research and policy analysis adding a public health lens to that context. And we've been working doing wildfire training and response in the last couple of years, principally since the Napa-Sonoma fires in 2017. Oops. So first, just recognizing that in recent years, we have experienced really prolonged fire seasons, as well as, and then not only just the lengthier fire seasons, but also deadlier fires of unprecedented magnitude. And then as these headlines reflect, it has become clear that the workers impacted, it's beyond the firefighters and emergency responders who are of course directly fighting the fires, but many issues have come up with other workers, including, for example, farm workers who are still out doing harvesting and other work in very smoky conditions. Sometimes last year, there's been concern about workers in evacuation zones, including farm workers, as well as day laborers and domestic workers who were still going to work in areas while many others were evacuated from those communities. So in that context, there's growing concern about that particular group of workers. But before we launch into the content, we would like to ask you to participate in answering a couple of questions. And so here is the first. We're going to have two true and false, and then a third question. And so the first true or false is, and you'll see it come up here, but because of concern about wildfire smoke, Cal-OSHA now requires employers to monitor the air quality index for PM10. So if you could please answer whether you consider that to be a true or false statement. Okay, thank you. So I see that about a little over 60% consider it true, and almost 40% consider it false. And the answer in this case is actually false. There are different air pollutants that are monitored, but in the case of the wildfire smoke standard, employers need to regularly monitor the air quality index, or AQI, for PM 2.5. And we're going to talk a little bit about that today. Here's one more true and false. Businesses whose employees work indoors are exempt from the wildfire smoke standard. So if you could again participate and indicate whether you think that is a true statement or false. Great, thank you. And yes, actually, 2/3 of you, a little over 2/3, think this statement is false, and that is indeed the answer. And we're going to talk about that as well. There's not an automatic exemption. This is not solely an outdoor standard, and so we will be looking at that because employers also have to consider it whether you are indoors or outdoors. And the third question is actually, it's a multiple choice. And here you can pick A, B, C, or D around the COVID-19 pandemic, and that it creates additional concern about wildfires because of, and it'll come up in a second, challenges in preventing infections, when evacuating, the impact, the increased severity of illness, and the strain on emergency responders, or all of the above? Yes. Okay, thank you. So this is not meant to be a trick question, but it's really an acknowledgement that right now, of course, there's been a lot of focus on in the last several months on the pandemic. And as you note, the answer is indeed all of the above. And these are three of the concerns that have been raised in terms of the intersection between the pandemic and what we need to be thinking about in terms of wildfire preparedness and response. Thank you for participating with us in those questions and responding. Oh, yes, and there's the answer, all of the above. So I want to acknowledge that there are a range of hazards from wildfires and also different types of workers involved, from the firefighters and responders who are directly out there fighting the fires, to the workers who are then involved in cleanup and are dealing with smoke, ash, and other debris. And the picture that you see in the middle are the workers that we're going to be focusing on today, and specifically those who are working and may be exposed to wildfire smoke in particular. We mentioned in the first question, what kind of particular matter the standard we're most concerned about, and it is this particular matter that's known as PM 2.5, which are tiny, tiny particles that have a diameter that's less than 2.5 microns. And as you see there in that image, that is a tiny percentage of the diameter of human hair. So these are tiny particles. And the problem with them is that while some larger particles can be eliminated in the upper respiratory tract, these particles penetrate deeply into the lungs. And as such, they end up causing the health problems that we're concerned about in the lungs and cardiovascular system. And to note through this image that some of the effects of these fine particles include not only some of the irritation in the eyes, lungs, and throat, but then breathing problems and other sort of respiratory challenges and asthma or other respiratory illness, but also cardiovascular problems are associated with them. Heart disease are worsened and other symptoms related to the cardiovascular system, and therefore the particles are related to premature death. So the EPA has an air quality index that they use to monitor air pollutants. And one of the pollutants that's monitored is PM 2.5. And you have probably seen this, but they have this index that rates levels from good all the way up to hazardous. And those are levels that are then considered in assessing what employers need to do according to the standard. And we will look at that a bit more today. But there are networks, there are air monitoring stations of different types located throughout California that the Air Resources Board uses, as well as if there are specific incidents that, like wildfires, there can be additional mobile stations that are deployed to do more targeted monitoring in those regions. We did mention, in the question at the beginning that there is this overlap and additional factors that we need to consider in the context of the COVID-19 pandemic. And in particular, there is what we're sort of mentioning today is the concern about how the wildfire smoke could actually increase the severity of people's experience of COVID-19 illness. There is some data from the SARS pandemic in 2003 that showed an association between air pollution levels and people's experience of illness. And there's also already preliminary data now from this pandemic that is showing a correlation with how a small increase in exposure to PM 2.5 can be linked to large increases in the death rate from COVID-19. So of course, because of the impact on the lungs, there's even greater concern of people having more severe illness if they're infected with this disease while also exposed to smoke. So in response to worker advocates, and it was the California Labor Federation, WorkSafe, and the California Rural Legal Assistance Foundation filed a petition with the Standards Board, and an emergency regulation was put in in place last July. You see there, it's in the California Code of Regulations, section 5141.1. It was set up as an emergency regulation, and it actually still is an emergency standard. It's been extended, and they are in the process of developing the permanent standard. And because of the COVID-19 pandemic, that has been, the sort of timeline that was originally developed has changed. But the standards board just voted to extend the emergency standard, and it's in place, I believe, until the end of September, while the permanent one is being developed. So who is covered by this standard? Well, there's two factors. One is that when workers are exposed to working in conditions where the AQI for PM 2.5 is at 151 or greater, so it has reached that level where the air is considered unhealthy, and that this is related to a wildfire smoke incident. So when both of those factors are at play, then the emergency standard is in effect. And so you'll see that there's some cases where there's exemptions. The exposure has to be at over 1 hour for that to be happening, for the emergency standard to be in effect. And there's exemptions for firefighters, as well as if an employer has a monitoring where they're proving that the AQI is below 151. And in case of building and structures that have air filtration systems, and there's all openings are kept closed. We'll talk a little bit more about that when we talk about the schools. But those are the two factors: is the AQI gets to 151 and there's a wildfire incident, and therefore you have to consider the requirements of the standard. And here are the main points of the standard. Employers have to identify exposures, so they have to know what the air quality index is in their area and whether there's exposure, what the level is for the PM 2.5. There also has to be a way to have communication with employees. That's a two-way communication that is also effective and easily understandable by the employees. There's specific requirements around training, and the standard has an Appendix B. We'll go over in a little bit what that is involved, but that it outlines what kind of training is required for workers. There's also the requirement to consider how you can control the exposures. For example, moving workers to an area where there is filtered air, or to another outdoor area where the AQI is not at 151 or above, as well as other administrative controls, such as considering changing in work schedules, adding more rest breaks for people to recover, as well as having a reduced intensity or pace of work. Those are some of the examples that need to be considered in terms of engineering and administrative controls to reduce exposures to those harmful levels. And lastly, there is the requirement for respiratory protection. It's considered voluntary use of respirators. If the AQI reaches 151 or above, the employer does need to provide appropriate respirators at that level, and workers can wear them. And then it is required respiratory protection if the AQI is at 500 or above. So those are the key elements of the standard. And let's look real quick about how to do the first requirement, which is identifying the exposures or monitoring the AQI. So there are different sites where you can obtain both the current as well as forecasted AQI levels. And so here you see, I looked at Air Now, the EPA site yesterday. You can input a zip code, and I put in Los Angeles, and you see there, you get both the color-coded maps that match the index, as well as a specific level for the different air pollutants that are monitored. And so we want to look at PM 2.5, and we see that the index was at 62. So that was the level yesterday in Los Angeles. I do want to note, if you go to there's a link there at the bottom right for an interactive map. It's a slightly different web address than the straightforward Air Now. And in that link, you can zoom in to a specific area more closely. So it can be useful if you're trying to zoom in to, sort of more localized regions. But AQI monitoring is required to happen before the shift starts and then periodically throughout the workday. So the employer has to know what the levels are And also that employees need to know how they themselves can check the AQI and get information. That's part of the training. And as I mentioned, there's different sites that can, where you can find this, including the ones just mentioned at the EPA, also the US Forest Service has information, the Air Resources Board, and some local air pollution and districts as well will post those. Here I was looking back at the Kincaid fire last year. I was only able to get the combined particulate matter and ozone AQI, but just wanted to show what the region looked like when there was the fire in Sonoma County. And noting that, you know, here's another map with the Butte County fire in 2018, how because of you have to be aware that even though the fire can be many hundreds of miles away, the AQI level reached, you know, very dangerous levels in the Bay Area, resulting from just the wind patterns from the Butte fire. So even though the fire itself might be very distant from the work location, we have to be aware of what the AQI is in our specific work location and notice that it can be dangerous. I had mentioned before that there are specific training requirements that are outlined in Appendix B of the standard. And it does note that the training should be effective and understandable by employees. So we always recommend considering the needs of your employees to see what the best training methods are going to be and language needs, etc. But the content is delineated here in terms of workers need to know what the health effects are and the risks. Also about their right to obtain medical treatment if needed and that there's no retaliation or reprisal if they seek that treatment. They need to learn how to obtain the AQI if they want to find the level during their shift, as well as what the employer is required to do according to the standard to protect workers. They need to know what the two-way communication system is going to be for the work site. We had mentioned that's a requirement, and so when they're out in the field or out on the work site, how is the employer going to communicate to them about any changes and how they themselves can report any problems if they have, you know, if they're seeing worsening air quality, or that should be there's a typo, I'm sorry, or symptoms that they're experiencing. They should also know what practices or how the employer is implementing any control measures to protect them. So what is the employer going to do in terms of some of the engineering or administrative control, sort of what is the plan should that happen? And lastly, even though respirators are considered voluntary use when the AQI gets to 151 until if it reached 500, the workers still need to be trained on the limitations and benefits of respirators, as well as how to put them on, take them off, and properly maintain, know when to change them out, etc. So this is all part of the standard, and Cal OSHA has translated this Appendix B into Spanish and Korean, and they're finalizing, I think it's still in finalization of the Chinese and Tagalog versions. So that is the overview that I'm going to present, and now I'm going to pass it on to Kevin Riley from UCLA Loesch. Thank you for your attention today.
Great, thank you very much, Suzanne. Can everyone hear me?
Yes.
Great, thank you. Good afternoon, everyone. Thank you very much for joining us this afternoon. My name is Kevin Riley. I'm with a program at UCLA called the Labor Occupational Safety and Health Program. We are sort of a sister organization to Suzanne's program at Berkeley. And like LOHP, we are jointly affiliated at UCLA with the Fielding School of Public Health and with the UCLA Labor Center. We also serve as a resource on safety and health issues for workers in our region of Southern California. Our programs provide a range of worker training, technical assistance, research, and policy analysis. And our program, oops, there we go. For the last several years, our program has been working jointly with LOHP at Berkeley on a statewide initiative known as the School Action for Safety and Health, or SASH. This program has targeted to K through 12 schools throughout the state, and it's designed to help schools develop and implement effective injury and illness prevention programs at their sites. This is a program that's funded through our state's Commission for Health and Safety and Workers' Compensation. And it's a training program that's specifically targeted to school employees who are involved with developing and implementing those injury and illness prevention plans. So typically our classes will include folks from risk management and loss control, some human resources administrators. We've had a lot of folks from maintenance and operations, head custodians, and other department heads. And often we'll also have folks who are involved with their health and safety committees at their school sites. So they take our programs as part of an effort to try and ensure that their safety programs are effective on site. In the last year or so, as the OSHA standard has rolled out, we've included a module in our training related to the standard and how it applies to school sites. And that's what I'm going to talk a little bit about today. We've also done some surveys with some of our course participants to better understand how they've been impacted by recent wildfires in the state and the kinds of support they have or have not had at their school sites as these wildfire events have unfolded. So schools have faced some significant impacts here in California as elsewhere from some of the recent wildfires that we've seen throughout the state. A lot of schools will face closures as wildfire smoke comes through. There's been a number of schools throughout California that have been damaged or destroyed as a result of these large wildfires. So clearly schools are one place where the impact of wildfires are clearly felt. In the surveys that we've done with some of our course participants, we found that about half of folks that we've interviewed have been impacted in some way by some of the recent wildfires in California. A few of them have had training or feel like they've had adequate support at their sites to figure out what to do as those wildfires move through. And of course, when we're talking about schools, we need to just remember that we're not just talking about teachers. There's a whole range of employees at these school sites. Everything from the custodial staff, maintenance and operations, there's food service workers, transportation workers, there may be nurses or healthcare professionals on site, as well as the administrative staff. So when schools are thinking about these issues from the point of view of an employer, they need to be thinking about all of these different roles, particularly when it comes to the way this new wildfire standard and other standards apply. So what have we learned so far from the work we've done in terms of how the standard applies to schools? What I want to do is walk through a few things, kind of taking the overarching framework that Suzanne has laid out and look at some of the particular ways in which this standard applies to school settings. So the first thing to talk about here is the issue that the standard applies, as Suzanne described, to both outdoor work settings and indoor work settings that do not have air filtration systems. So as a starting point, most schools will have employees that are working outdoors that are potentially exposed for an hour or more if the air quality deteriorates as a result of a local wildfire. So here we're thinking about staff like groundskeeping folks, custodians, maintenance and operations, maybe some of the transportation employees. So as a starting point, schools are covered by the standard at a minimum in order to ensure that there are proper protections in place for these outdoor employees. In terms of the indoor aspect of the standard, most of the indoor classroom space and office space would be considered exempt by virtue of the fact that it has air filtration systems, and OSHA has sort of clarified some of those. But there's a few ways in which school indoor spaces also might be a concern. So depending on how the school is designed, for example, you see some pictures here of classroom spaces that feed right out into open areas. In these cases, because of the frequent movement of students and staff in and out of these rooms, even though the classrooms themselves may have air filtration, there may be concerns about air quality inside those classroom spaces. School sites may also have things like garages or maintenance facilities, storage facilities on site where there's not air filtration as there would be in, say, a classroom or an office environment. And in those situations, any employees working in those areas would also be covered under the standard. So a school would have to be considering those employees and protections that they would need to take for them as well. As Suzanne described, part of the requirements of the standard for employers is to be monitoring the AQI, the air quality index, and to be informing employees when the current AQI for PM 2.5 reaches certain levels as a result of nearby wildland fires. One of the things that we've heard from a lot of the participants in our class, which is sort of a unique issue, I think, for schools, is that the school as an institution might not be making decisions directly on site, that they're also embedded in larger districts or have a larger kind of administrative organization above them. And oftentimes there'll be decisions made about overall processes and procedures or health and safety. It's made sort of at the district level. One of the things that OSHA would make clear, has made clear here in the standard, is that at least for this kind of hazard, the air monitoring has to be done specifically at the school site, and decisions about implementing control measures have to be site specific. That it's not sufficient for the district, say, as a whole, to be doing that air quality monitoring for all their schools, but it has to be done on a site-by-site basis. And this is really important. This photograph here you see comes from Lake County. This is a soccer field at a school facility several years ago, where over the course of this game that was taking place, you had wildfire smoke moving in from a nearby wildfire. And so one thing here to say is that obviously in this case, now that we have a standard in place, there would have to be personnel at this school who are designated to be monitoring that air quality as the quality would deteriorate. It's also important to note here that, you know, the air quality can shift very quickly in the face of these wildfire events, depending on the direction of the air, the size of the wildfire. I mean, in this case, we're talking about a school that's not even necessarily in direct vicinity of the fire itself, but clearly is being severely impacted by the air quality that's coming from the smoke that's moving in the direction of this school. So several things to say about control measures in terms of what they might look like in a school setting. If we think about kind of a hierarchy of controls perspective, obviously the best approach as AQI deteriorates would simply be to close the school. And we see that happens frequently as wildfires emerge. School closures are fairly common. The thing that we want to emphasize is that often those decisions are made with the well-being of the children, the students in mind, and sometimes not so much thinking about the employees. And in fact, in some cases, the school may be closed to classes, but there may be employees still on site continuing to work, both in indoor and outdoor spaces. So the standard here is basically requiring school employers to be thinking about closures and taking these kinds of measures, not just for the student body, but also for their other employees that they may continue to expect to be on site. Above and beyond the closure, there are additional engineering and administrative controls that employers are expected to follow once the AQI reaches a certain level. These here are some of the general points that are mentioned in the standard itself in terms of moving outdoor work to enclosed buildings or structures or vehicles with filtered air, changing work schedules, relocating that work, or providing additional rest periods. So there are particular ways in which schools might interpret these measures, and they may find other measures as well. Things like, adjusting the work hours of their groundskeeping staff so that folks are not out there during the hours when the AQI is particularly bad, or temporarily reassigning employees to other school sites that aren't being as heavily impacted by the wildfires. And then finally, the issue of respiratory protection. Now, obviously, these pictures here are students wearing masks. As Suzanne described, there is respiratory protection built into the wildfire standard. When the AQI reaches 151 or above, there's voluntary respiratory protection that can be used. And then if the AQI exceeds 500, there's mandatory respiratory protection. For most schools, I think when we get to the 500 level, that's more or less like we've seen schools have functionally shut down, so that's not necessarily a concern, although there could certainly be concerns, as I said, if there are employees still on site. But a couple things here I think we've been trying to emphasize in the work we've done. One, particularly that's related to the coronavirus situation, is that given the shortages of N95 masks and the real critical need to ensure that healthcare workers have access to those masks, that schools and any other workplace for that matter should really be planning ahead and thinking if they have stockpiles, to have plans to either hold on to them, or even more importantly, again, from a kind of hierarchy of controls perspective, is not relying on respiratory protection, but really looking to use other forms of administrative and engineering controls so that we're not having to rely on those masks, so that we can really make sure that the N95 masks are mostly available to the healthcare workers that need them at this moment. And then finally, just a couple of other considerations that I know has been on our minds as health and safety professionals here over the last several months and in our conversations with school personnel. One issue is that in the current coronavirus situation, obviously a lot of schools are not holding classes in person. And so to some extent that helps in terms of protecting employees on site who might be impacted by wildfires as the wildfire season happens. But these schools aren't fully shut down. There are still staff that are on site performing certain tasks, whether it's maintaining the buildings, or as you see here in a picture like this, there you have teachers and others who are on site to distribute food and resources to children and their families. So schools do need to be keeping that in mind in relation to the standard as if the schools are impacted by wildfires. And then the other overarching issue, which is not built into the standard itself, but certainly something that we are concerned about, is that there are a whole range of additional hazards that are associated with cleanup work. So as soon as the immediate wildfire hazard passes, as schools are bringing employees back in to clean up the ash and dust and debris that may have been left behind, we acknowledge that it's critically important that those employees have proper training and the protections needed in order to perform that work safely. So finally, I want to just share a couple of resources that may be valuable to folks if you need it. This is a guidance document from Cal EPA's Office of Environmental Health Hazard Assessment. This doesn't acknowledge the Cal OSHA standard per se, but it does provide, I think, some really good overall guidance information for schools in terms of thinking about wildfire smoke events. And there's some information here about indoor air quality, sort of how to maintain safety overall for both staff and students. Our program at UCLA has developed a fact sheet in both English and Spanish more generally for the related to the standard and its requirements. So this is available on our website. If folks are interested to download that, you can find that there at the link below. And then if anyone is interested in more information about our School Action for Safety and Health program, both UCLA LOSH and LOHP at Berkeley have pages on our websites describing the program and how you can get involved. So just wanted to give a little quick plug, particularly since we have a group of folks online who are from schools. If you may be interested in additional training or resources, feel free to reach out to us. And with that, I would like to thank you very much, and I'm going to hand over the controls now to Teresa.
Do you hear me?
Yes, we can hear you.
Okay, good. I cannot move the screen. Okay, so before I start with the topic, let me tell you a little bit about our center. The center has been based at UC Davis for almost 30 years. We are one of 11 nationwide funded centers by NIOSH. The main goal is to improve the occupational health and safety in agriculture. We have multidisciplinary researchers. When some of their findings are ready to be translated into lay language, they work closely with the outreach team. The outreach team, in average, reach over 3,000 people during the 1 year with trainings, presentation, and health fairs. The methods we use during the trainings are based on popular education. This means we're trying for people to be critical, to find practical solutions to their challenges. We offer information based on the science, and we're trying to reach different kind of groups. We reach the supervisor and we offer them practical solutions to comply with the law and protect the workers. For the farm workers, we focus mostly in their rights and what they can do to change the work culture in the workplace, and to the community, because if we don't have the support and the awareness at the community level, changes sometimes are a little bit difficult. So in 2018, we have a very bad fire season. As you can see in the map, the air quality across California was affected badly. In the north, we have the Camp Fire that affected 1.8 million acres. And in the south, we have other fires. So the air quality was very bad, not just around the fires, but just across the state. However, you could see farm workers still working in the fields of California. So we decided to do something to improve this situation. And we partnership with the California Institute for Rural Studies to conduct surveys with growers, supervisors, and focus groups with farm workers. The interviews and the focus groups were conducted from the border to Mexico to the north of the Central Valley, Stockton, Modesto area. The findings were interesting. The employer awareness, as you can see in here, they say, this is a testimony from someone in San Joaquin Valley. They say that the air quality warnings, they get them regularly, but they feel they were not impacted as bad as we were asking them. However, you could see the workers there and the smoke in the air, but overall, the employers were little aware of these kind of issues, and they didn't have action plans to solve the issue to protect the workers, and none of them mentioned the use of a mask. I have another testimony for a grower in the Imperial Valley. Imperial Valley is in the border with Mexicali, Mexico. So they have the Salton Sea in there. And if you are familiar with that, for years and years, water was brought from the fields to the Salton Sea with pesticide residues and some other chemicals. And now the sea is shrinking. And when it's windy, the bottom of the lake is exposed, and the dust from that lake is very irritating. They have very high number of cases of asthma in that area. They also think that is pollution coming across the border from all the plants and in the other side of the border. So they didn't put together the wildfire smoke air quality with the other two situations they were experiencing there. They also, in the Imperial Valley, they have a very strong air monitoring program. And they have these systems when the school have flags with the color of the flag reflects the quality of the air in the area. But again, wildfire smoke was not one of the things they were really concerned in that area. When we interview the farm workers directly with the focus groups, we saw a better level of awareness of how they were feeling when they was a smoky condition and they had to be working in the fields. But it was a little bit of confusion. You can see here how they say the whole area looked very reddish, right? So it's like they know something is different, but it was not really awareness of what was the difference between the regular pollution or the wildfire pollution. Some of them, the majority of them, I think that with a handkerchief or bandana across their face, they were going to be okay. I have to tell you, the bandana is a common use mostly for farm labor, for farm worker women, because they protect their faces from the heat, from the pesticide residues, for the dust. So they are very used to have the bandana as protection. They say that if the air quality is very bad, they could use double bandana. They fold the bandana in two. So if they double, they will have 4 layers of cloth protecting them from the pollution. Of course, that is not enough in wildfire smoke situations. Some of them even mentioned that if they wet the bandana and have the humid bandana across the face, is even better. So with the results, something we identify is that the role of the supervisor is crucial for the use of the mask. The N95 could be properly used for farm workers. So we see if the supervisor feel like, ah, no, this is just like other regulations. Yeah, I'm going to do it, but I'm not going to be trying to explain why it's important. The crew is not going to use them. But if the supervisor is very aware of why it's important and how to properly use the mask, the crew is going to use it. But again, it's for us, it was identified that it's crucial to educate the farm workers, but even more crucial to educate the supervisors, because supervisors are very important. And I will use this group of circles to explain how I see the role of the supervisor. The red asterisk is representing the supervisor. So he is like a bridge, like the broker between the worker and the work site. The supervisor, we believe the supervisor have to be aware of the standard and also aware of how the workers and the leadership in the workplace interpret the standard, because he is going to make the case with the leadership of the workplace, but also is going to make the case with the workers on the importance of protecting themselves. We also believe that is needed like multi-level approach where the community be involved, because farm workers are very, very lacking power. They feel like they cannot speak up, because if they speak up, they could be perceived as weak, and then they are not going to have a job the next day, or they are going to be seen as a troublemaker trying to ask for protection of the law when it's not possible. So a lot of the farm workers, and some of them in the focus group, some of them express this concern that, yeah, we know we need to be protected. Yes, we know is the right, but if we speak up, we are not going to have a job. So with a multi-level approach campaign for education, we could improve little by little. The regulation does a lot. We saw the case with the heat illness standard, and when they have a campaign, they were more able to create a change because everyone in the community, agricultural community, were aware of how things could start changing. So to help them in this effort, we created a poster. It's a 4-section poster. The poster is available in English and in Spanish and comes with a discussion guide to help the supervisor or whoever is training the workers on the importance of using the protection and be aware of the wildfire smoke impact on their health. The first section, we explain that people that are not close to the fire, the main risk is the particles in the air and how this may travel with the wind, and then the size of the particles and how if they go into their system, they can go into the bloodstream, and then they are going to have not just the immediate effects, but also long-term effects. Could be like a scarring of the lungs or rapid heartbeats, and is going to affect their cardiovascular health overall. So the discussion points are brief, are clear, and we say in the guide, these are just suggestions on how we suggest you to explain, but we encourage people to do it in their own words. The next page explains about the air quality index, what it means, what it represents, the different levels of protection. We say that when the air quality is bad, they need to use a mask. And we also explain in this one that a bandana or a cloth surgical mask is not going to be enough protection. And we explain that in the discussion guide, we explain why is not enough protection. The third page is about the importance of having a clean face. Any hair, even like the end of the day hair that some men grow during the day, is going to prevent the respirator to seal around the skin. Because the use of respirators is voluntary, they don't require to have the fit test. So it's crucial for the supervisor to explain how to wear properly. And it includes how the placing of the elastic bands on the head to ensure that all around the mask, is going to be sealed on the skin, and how to adjust the nose piece. All the people I talked with when we were developing these materials that manufacture the respirators, they say you have to throw them away at the end of 8 hours, because after 8 hours it's not going to be good enough, or the quality is not going to be there to start preventing the small 2.5 particulate to be brought in when people breathe. The last part of the poster talk about worksite and reminders and tips. We recommend them to slow down, because the sweat around the mask irritates the skin, and then the worker feels like they need to remove the mask. We encourage them to tell the supervisor, and we tell them it's your right to be protected, to tell the supervisor if they experience any symptom. And as a solution, we say you can remove the worker from the field, bring them to an enclosed area. The more practical, we think, in the middle of the field is a car with the air conditioner running. So in there, they can remove the mask and start trying to feel better. If they don't feel better, they have the right to seek medical attention. And we explain to them that that will be covered by workers' comp. I would like to point that during the trainings, we expressed the difference, because there was some confusion in the agricultural community. Why is the respirator at the beginning of the COVID-19 was say, no respirators, and suddenly it's like no respirators, but then a cloth mask. So the goal of the respirator is to prevent particles to coming in, to not be breathed. So a respirator has to have the seal, is the N95, meaning N, not resistant to oil, 95 of the particles in the air, 2.5, are going to be stopped at this filter. So it has to be snug and sealed against the skin. And the main goal is to prevent particles to go in. However, the face cover is something different. The main goal is to prevent the small droplets that people are exhaling to go out. So in the mask is preventing the particles from preventing them to coming in. For the clothing is to reduce the risk of droplets to go out, and with that mitigating the spread of the disease, but they don't block small particles. We don't know if OSHA is going to be really checking and being very strict, requiring the mask in case of wildfire, because we know there are not enough masks for everyone. So we encourage the growers and every employer that has workers working outdoors to start trying to create their stockpile to protect the workers, because if they are trying to say, I'm giving them cloth masks to protect them from the wildfire, that is not going to be enough protection. They are going to be breathing the damaging particles. And with that, that's it for me. Oops. If you have any questions, you may contact. My email is in the resource page, or you can go directly to the website of the Western Center and send us questions, and we respond to everyone.
Yes, thank you, Teresa. And so that wraps up our presentation. And there are some resources that we have here, both in terms of OSHA, their page on the standard, and some of the Appendix B. The last two are in Spanish and Korean. The UC Davis materials that Teresa has described, and then the links that Kevin gave. And you'll get that as well for registering with the materials that will be sent out afterwards. But now we wanted to open it up to see about if you had any questions on this material. And I'll hand it over to you, Jessica.
Yes, thank you so much, all three of you, for this presentation. I'm going to go ahead and go through some of the questions. If anybody has a question, please type it into the Q&A box. It should be at the bottom of your screen. Some of you, it might be on the top. There are some similar themes that I'm seeing here, so I'm going to go ahead and ask this question, which should answer a couple. Can the purple air monitoring system be used to determine AQI levels in accordance with OSHA requirements?
Is that, I'm sorry, the purple air monitoring system?
Yes. And I've actually had a couple of people who asked about that particular air monitoring system.
She or he means the level, for the purple level, that is the 500?
No,
I think
the
it's
purple
a
air
type.
monitoring system is a monitoring system. And if anybody has any feedback in the that would like to type it into the chat box, that would be great also.
Yeah. I'm not
Because
aware.
they may not measure down to the 0.1 U, and they wanted to know if they can determine AQI levels, if that is a system that they could use.
Yeah, I'm not familiar with that system, and I'm not sure if the co-presenters are. There is an Appendix A that's part of the standard that does give specific information on what would be required if the employer is going to do the monitoring themselves, as opposed to relying on some of the, sort of government resources or other monitoring results for the AQI. I'm not sure if that's going to provide the information they want about a specific system. I mean, it does say in Appendix A that the monitor has to measure concentrations ranging from 0.1 microns up to and including 2.5 microns. So I'm not sure if that particular monitor is doing that.
Thank you. And somebody did post a link at purpleair.com that does have some information. And someone else, Stephanie Holm, just wrote, purple airs are high quality, low cost sensors, but the absolute number is not always accurate. So they should be used for getting a sense of spatial variability, but do not generally meet government standards. And that's Stephanie Holm, MPH from Western States Pediatric Environmental Health and Specialty Unit.
Oh, thank you.
Again, I think another question similarly was IQ air visual. So similar question, just if that meets the requirements of monitoring the AQI 2.5 levels. And I think just altogether, some of the attendees are probably just looking more for, do you have just any idea of brands or systems that are okay that you can share for outdoor air monitoring?
I do not. I mean, that's an interesting question, and I haven't seen specific ones recommended over other ones, but maybe, yeah.
I don't know either, because it's very technical, and the person using those systems have to be trained specifically for the specific system they are going to be using. So no, I don't have a recommendation.
And nor do I. I'm not familiar with specific systems.
Okay, thank you. Let's see. So due to COVID-19, many children have had virtual learning at home. Are there any public health suggestions for parents when smoke or AQI issues occur?
I saw this question, and I also saw the question above about the recommended PM 2.5 levels for schools canceling sports.
Yes.
What I would recommend in both cases is to look at the Cal EPA document, which I had sent, which I had included in my slides, and I just put it in the chat box. I think in terms of children working at home, one thing that would probably be recommended would be to have the students inside with air cleaners with HEPA filters as a way to try and filter the air as much as possible. But of course, the COEH standard isn't necessarily going to extend to to children at home, but I think that's a good practice. And there's some more details on that fact sheet.
Great, thank you. And again, some of these resources will be available on the resource sheet that's actually on the web page now, coeh.berkeley.edu/20 WEB 0603. Let's see, so I'm going to try to get through as many questions as I can. I know we're getting close to time, but we do want to make sure that these questions are responded to. Are there any other states where wildfires are occurring where these California standards or similar types of standards are being enforced or regulated that you know of?
No, at the level than it is in California.
Yeah, this is the only state in the country at this point with a standard, an enforceable standard.
Thank you, guys. Also, if we as employers issue masks for the purpose of worker protection, do we have to provide a spirometry and questionnaire?
For the wildfire smoke, no, because the use is volunteer. But if the air quality is 500 or higher, I think they do. Am I wrong?
No, I think that's correct. So in any situation where an employer is providing respiratory protection, you need to follow the respiratory protection guidelines, which say that it's not required for voluntary use, medical testing, but it is once if workers will continue to work in situations where the AQI exceeds 500, there's mandatory N95 use, at which point there's also medical evaluation and fit testing requirements.
Yeah, that's why it's crucial for people that are going to be using the mask to know how to use it properly and to know the possible effects. And it's going to be a little bit harder for them to breathe. So they have to slow down the pace so they don't push their body to the limit, because there is no way to check if they are healthy enough to have that stress.
Thank you. That was another question that one of the participants had was, can you confirm if a respiratory program is required for medical issues to determine if a worker is healthy enough to actually wear those face respirators?
Yeah, so they have to be very aware of the signs of they are being affected and report immediately to the supervisor.
I want to mention that the second resource that's listed under the Cal OSHA section of our resource page is a fact sheet on what does voluntary use mean and what's required for respirators. So that might be helping to answer some of these questions as well.
Thank you. Another question was, at what ppm do workers, and I want to say it's AQI, but do workers have the right to refuse work regardless of whether they have been offered a mask or not?
There is no specific limit, but they always have the right to say, no, I don't want to do it, I cannot do it, if they feel there is a risk to their integrity or their health.
Thank you. And let's see, so we have a couple more questions. How do you incorporate the heat stress standards and controls with wildfire standards?
That's a great question, I think. I mean,
yeah.
Oh, go ahead, Teresa.
No, go ahead.
Well, I mean, my immediate thought in thinking about that is to also go back to a kind of hierarchy of controls perspective. So if there's sort of air quality issues combined with heat issues, the best way to approach it would be to move workers off the work site to ensure that they're not exposed to those hazards in the first place. But how does that work in practice in the fields?
It's very difficult, but when people attend our trainings, we always tell them, when you find a solution for a hazard or a way to prevent something from happening, think about the holistic approach. Maybe you're protecting them from the fire, but is this going to increase the risk for heat? So what could be the solution for both? Trying to minimize the risk for the workers. So it's very complex in agriculture because there are so many risks out there. So the only thing we're trying to say is discuss practical solutions, brainstorm, and what could be the best middle way to protect the workers.
Thank you. We had one participant that was wondering if air quality has exceeded 500 at most of these California wildfires.
It depends how close to the fire you are.
Mm-hmm.
Very close, I'm sure it will, but kind of far, not really.
Mm-hmm.
Yeah, that is a question that I think advocates are asking about in terms of those trigger levels and how protective they are. And so, for example, in the development of the permanent standard, and there's comments right now that are being accepted for that process, there are calls to maybe lower the trigger, both to lower it to 101 for that initial, point where there's requirements, but also to lower it to 300 as opposed to 500, because we're trying to, for these workers who are definitely reporting symptoms and issues and challenges, but probably not at a 500 level, we still want to figure out what does that mean for their health and what kind of protection they need. So that's something that's being considered that's being advocated for the permanent standard. Mm-hmm.
Thank you. Also, one of the participants wrote that per Cal OSHA respiratory standard, voluntary use of the N95 does require the employer in such situations to provide the worker with a copy of Appendix D.
Yeah, and that's an important provision because that's information for the worker about what the risks are of respiratory use, respiratory protection.
Okay, well, I think we got through most, if not all, of the questions, and I just wanted to say thank you again for coming in and presenting on this really, really important topic.
Well, thank you. We really enjoyed it.
Thanks, everybody.
And for everybody who joined us today, make sure that you check out our website for more information, coeh.berkeley.edu/about-CE. As a reminder, an email will be sent out tomorrow with the webinar recording, the link to those resources, and an evaluation link for your continuing education contact hours. Thank you again for all your questions and participation, and I hope all of you have an enjoyable day.